how exciting. You're probably wondering what is happening there. Welcome back to Dr. Derm Diaries for another exciting episode, you little nodules. Let's get into it. Firstly, I want to thank you for watching the videos and giving all the great views and increasing the number of followers that we're getting. Please keep doing so to help grow this channel so that we can keep producing amazing content for you. So, what is happening here is that we are doing cryotherapy for the patient. This means that we are literally freezing these lesions off of the patient's skin, and we use something called liquid nitrogen. This is at minus 196 degrees Celsius. Absolutely cold. And before you say anything, I did turn the volume down to 1 out of 100 for this clip. But unfortunately, this is the lowest it can go, so I do apologize if the volume of the spray gun is loud. The spray gun allows us to direct the liquid nitrogen at 196 degrees directly onto the individual lesions to freeze the cells. This freezes the water within the cell so that it takes it to sub-zero temperatures, causing direct death of those lesions by something called tissue necrosis. As the skin lesion then heats up to reach its normal temperature again, this changes the temperature and therefore shifts fluid within those cells, causing further damage and death of these skin lesions. These skin lesions then simply just drop off, leaving the absolutely normal healthy skin underneath. This patient here is having this treatment done on something called skin tags, as you can see being held by the forceps. This technique can be used for many other types of spots and lesions and warts, but it shouldn't be used on skin lesions that have not got a diagnosis or skin lesions that may potentially be cancerous. Other times where it shouldn't be used are, for example, in young children, patients that are unconscious, or patients who have conditions that can be made worse by cold exposure. These conditions have names such as Raynaud's disease, cold urticaria, cryoglobulinemia, and multiple myeloma. This treatment is safe and it is effective, and it's a very simple procedure. For some lesions, it can actually require several treatments for it to have the full effect. And that's because it depends on the size and thickness of the individual lesions, meaning how well can the cold penetrate to cause the effect. There can be some side effects due to the cold effect. Some patients could get pain. Others could get a bit of numbness around the area. Others could potentially get things like headache or a little bit of fluid retention. And sometimes if the cold does hit the skin for a bit too long, some patients can get a little bit of blistering. Rarely, some patients may get an infection. Others may get lightening of the skin underneath. Others may get some scarring. But because of the good technique that we have and the great care that we have for our patients, we make sure that we absolutely minimize those risks. We also provide great aftercare for our patients, and therefore they don't get these complications. Here are some before and after pictures of cryotherapy and what can be achieved when done in the right way. In the follow-ups, the patients always tell us how they feel so much better, how much it's improved their self-confidence, and that is an amazing outcome, and that's what we're here to do. So I want to thank you for watching, thank you for subscribing, make sure you share, and stay tuned for the next episode.